Look good on your lunch hour. Sponsored by the Advanced Cosmetic Surgery and Laser Center.
Good afternoon once again. Newer trend in cosmetic surgery is surgery that doesn't look like you had surgery. It's often referred to as undetectable. And joining us now to share what that means, we welcome Dr. Jon Mendelsohn of the Advanced Cosmetic Surgery and Laser Center. Good afternoon to you. So what is it if it's undetectable?
Well, there are a number of things. The first thing is, I would say, undetectable in a way that isn't unnatural, where somebody walks into a room and you're quietly, saying, asking if that person had cosmetic surgery. That's never the goal. When we're talking about undetectable, though, we're talking about the design and the placement of incisions. If we're talking about a lift, same thing with a blepharoplasty or an eyelid procedure. So it's really being thoughtful, thinking through the approach to surgery. With techniques these days, we want to minimize bruising, swelling. Even during the early phases, we want to make it look more natural and less noticeable.
All right, so we have a little video of a patient that we've been following with you. Just tell me a little bit about what goes into that sort of more natural look. Does it take longer? Does it cost more? Does it cost less? That kind of thing.
Yeah, well, a lot of it is based on one's anatomy and understanding exactly what our goals are and what we're doing. So you're showing now, I think, some eyelid surgery, but where we measure and mark these, where we intend to make the incisions are a really important part that might vary a little bit from patient to patient. More than even the undetectable nature there is really understanding the psychology, the rationale why somebody's undergoing a procedure. But what you're showing is an incision that is being made inside of an ear canal. I want to be careful with that. It's on the edge, actually, that little bump on the cartilage. We make a marking there so that as a female, if you're looking at somebody's ear, it should be undetectable in a sense that you can't tell that that went inside that anatomic area. We come up into the hairline and do the same thing. What we're showing here is just some meticulous closure of those incisions, and ultimately those sutures, while they're placed at the time of surgery, are removed about a week later. They are dissolvable, but we have you come back to remove them. And you will see, and I think in perhaps some of the photos that you have, you'll be able to see some of the incisions. They're still a little bit pink. I won't say that's completely undetectable, but with a little bit of makeup or tinted moisturizer or sunscreen, they're relatively easy to hide. The goal here is to have a refreshed, natural appearance.
All right, so let's just put up those pictures where we tell people how to find you. This is her intermediate picture. We're going to be sharing her final results tomorrow night at 6 here on Local 12. But
right, so those are about 4 weeks,
yeah,
right there. And I think you have 6 weeks. Just 2 weeks later, you'll see how she's changed.
Yeah, we just put one in for now, but it's pretty remarkable that it does look still like her, just what you said, the goal kind of refreshed.
Right. And, in this photo, obviously, she still has a lot of swelling, some edema, we call it. You can see your eyelids look thicker than they will appear. But she's certainly coming along. And most patients, while they look pretty good fairly quickly, they start to own it more about 6 weeks, where they really start feeling, how they feel on the inside is how they're starting to appear on the outside. So
and that's
it really
what
has come a long way.
she told us was her goal, which is really great. So we're going to put up a phone number for you. I know these range in the $15,000 to $20,000 surgeries for the whole full face, but we're going to have the big reveal tomorrow night at 6 on Local 12. If you want to find Dr. Mendelsohn, find him at 513-351-3223. We love your teaser. Thank you so much for working with us on this story. It's been really interesting to watch.
Thank you very much, Liz. We appreciate it. Thank you.
All right. Thanks, Jon.